Hey everyone! Today we're going to be talking about what happens when psoriasis affects a sensitive area of the body, your private area. This is called genital psoriasis. Hi, I'm Dr. Jennifer Song. I'm a board-certified dermatologist and clinical researcher. Did you know that the first ever clinical trial was just recently done specifically in patients with genital psoriasis? This topic has been rarely discussed or even researched, mainly because it's a little bit embarrassing for patients to bring it up, and doctors aren't good at asking either. So let's take a closer look at what happens when psoriasis affects this sensitive area of the body. Patients with genital psoriasis say it's the worst. It can be more itchy and more painful because the skin is thinner and can easily tear. And let's get straight to the point. It's embarrassing and it affects your sex life. Usually, people have other spots of psoriasis elsewhere on the body, but sometimes this can be the only area that's affected. And this can mean that the diagnosis of psoriasis is harder for your doctor to make. Genital psoriasis looks different than psoriasis elsewhere on the body. The psoriasis spots are usually pink to red, much thinner, and have little to no white scale. So how do you know it's psoriasis? Many patients wonder if they have a sexually transmitted disease. If you already have the diagnosis of psoriasis, then chances are it might be psoriasis. Genital psoriasis is also often confused for a yeast infection or a fungal infection. In certain situations, your doctor may decide to do a biopsy to help make a diagnosis. A biopsy is when we take a small sliver of skin about the size of a pencil eraser head and look at it under the microscope. There are many different rashes that can occur in this area, such as eczema or even skin cancer. So it's best to find a dermatologist who can check your skin and discuss your symptoms individually. Let's talk about treatment. Topicals are a great place to start. The tricky part is finding one that is gentle because the skin is thinner and more sensitive in this area, but also strong enough to get rid of the inflammation from psoriasis. Options include topical steroids, vitamin D-like derivatives, and anti-inflammatory creams that are non-steroids. Now, if topicals aren't working or you're getting side effects like burning or easy tearing of the skin, then systemic medications like pills or biologics are next. The first and only clinical trial ever done specifically in genital psoriasis patients recently showed that treatment with Taltz for 12 weeks cleared genital psoriasis in over 70% of patients. This was also the first time that patients were asked about how genital psoriasis affected their sex life. Medications like Taltz have certain risks and side effects. So, which biologic is best for you will depend on your previous medical history as well as the severity of your psoriasis. Genital psoriasis can make your sex life more complicated, but that doesn't mean you can't if you want to. Remember, psoriasis is not contagious. Here's some helpful psoriasis sex tips. Use your topical as directed by your doctor. Using it more frequently to help it heal faster may result in side effects. And remember, use lots of lubricant and keep it clean. Knowledge is the key to living with psoriasis. Let your doctor know if you have symptoms in your private area. We have amazing treatments. Thanks for watching today, and if you want to learn more about psoriasis and other serious skin conditions, subscribe and follow me.